is coronavirus? Coronavirus disease COVID-19 is an infectious disease caused by a newly discovered coronary virus. This pandemic was initially detected in mid-December 2019 in the city of Wuhan, Hubei, China, and it was recognized as a pandemic by the World Health Organization (WHO) on 11 March 2020. COVID-19 affects different people in different ways. Most infected people will experience mild to moderate illness and recover without specific treatment. A person with COVID-19 disease can be detected through some symptoms. The most common symptom is fever, dry cough, and fatigue. Meanwhile, the less common symptoms is body ache, headache, conjunctivitis, and loss of sense of taste or smell. But it is likely that a person can be infected by coronavirus without any symptoms. The time between exposure and started of symptoms is usually 5 days, but may range from 2 until 14 days. The COVID-19 virus is spread through droplets that occur when an infected person coughs, sneezes, or inhales. These droplets are too heavy to float in the air and will fall directly to the floor and or surface. A person can be infected by inhaling the virus when in close distance to a person infected by COVID-19 or by touching a contaminated surface and then touching their eyes, nose, or mouth. Some precautionary measures are taken while waiting for the result of the vaccine research to restrain the spread of this pandemic. The recommended preventative measures include washing hands, covering mouth when coughing, keeping distance from others, especially those who are unhealthy, and 14 days monitoring and isolation for people who suspect they are infected. Recently, COVID-19 cases are increased in Malaysia. The result of the research were found to restrain the spread of COVID-19 virus after almost a year of running. There are several vaccines used in Malaysia. This means outside of COVID-19 vaccine that are currently being used in Malaysia are validated by WHO, which is Pfizer vaccine and Astrazeneca vaccine. So, what are the differences between Pfizer vaccines and Astrazeneca vaccine?
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad IZUAN bin SUHARDY and my metric number is 059423. I will present about one of the COVID-19 vaccine, which is Pfizer vaccine. The Pfizer vaccine has been developed by an American corporation called Pfizer in New York and BioNTech, a German biotechnology company based in Mainz, Germany. Pfizer is one of the largest pharmaceutical companies in the world and over the years has been responsible for many of the essential medicine used by millions of people around the world. Public Health England (PHE) also confirmed in May that the Pfizer vaccine is 97% effective in preventing death from COVID-19. After the first dose of Pfizer vaccine, protection sits at 80% and rise to 97% following the second dose. In Malaysia, Pfizer vaccine is the first vaccine to have obtained conditional approval from Pihak Berkuasa Kawalan Dadah (PBKB) on 8 January 2021. As February 2021, Malaysia has gained access to a supply of 66.7 million doses of Pfizer vaccine. Kementerian Kesihatan Malaysia (KKM) on behalf of the government has signed an agreement with the Pfizer Malaysia Sdn Bhd on 11 January for the purchase of this vaccine. After purchase the Pfizer vaccine, Malaysia start the national COVID-19 immunisation program on 24 February 2021 by using the Pfizer vaccine. The program will be begin with the first Pfizer vaccine injection, which will be received by Yang Amat Berhormat Tan Sri Muhyiddin bin Haji Muhammad Yassin, the Prime Minister of Malaysia, and Ketua Pengarah Kesihatan Malaysia Tan Sri Dr. Nur Hisham Abdullah with frontliner officer. There are 3 levels of this immunisation program, which is in phase 1, frontliners officer, such as doctor, teacher and health officer will receive the first vaccine injection. in phase 1, followed by senior citizen aged 60 years old and above, and high risk group in phase 2. And the last phase involved resident in Malaysia aged 18 years old and above. From this immunization program, we can conclude that this Pfizer vaccine is very important and effective, and everyone need to be vaccinated to protect against this COVID-19 disease.
Assalamualaikum warahmatullahi wabarakatuh. My name is AMIRATUL binti MOHAMD and my metric number is 05805. So today I will explain to you about COVID-19 vaccine, which is AstraZeneca vaccine. As we know, there are two types of vaccine that has been listed by World Health Organization (WHO). This vaccine is to prevent the COVID-19 virus. First of all, I will explain to you how the COVID-19 virus works in our body. So to begin with, we have the COVID-19 virus and it has on the outside what we call spike proteins. Now these spike proteins will help the COVID-19 virus to connect or attach to our healthy cells. So once the spike protein stuck into our healthy cells, the virus is able to put itself into our healthy cells and take over. This is otherwise known as infection. The problem is COVID-19 is very good at not getting cough, and it is very good at being able to hide inside those cells, which means that the virus is able to use the tools within your healthy cells to multiply and replicate, and once it does this, it's then able to go to infect more healthy cells. Our immune systems take a little bit of time to notice the virus, but once it does it will start to build defense proteins, which we call it as an antibody. So the antibodies will be stronger to against the bad virus if we take the vaccination. And I will explain to you who can take this kind of vaccine and who are not recommended to take it. Vaccine supplies in Malaysia are so limited. It is recommended that the priority be given to health workers at high risk of exposure, such as frontliners who are trying to save people's lives every day. And also, it is recommended to give the priority to the older people, including those aged 65 and above. Other than that, it is recommended for persons with comorbidities that have been identified as increasing the risk of severe COVID-19, including obesity, cardiovascular disease, respiratory disease, and diabetes. Next, many people always raise the questions of whether pregnant women should be vaccinated or not. The answer is yes. Well, COVID-19 is easy to infect the pregnant woman, but there are very little data are available to assess vaccine safety in pregnancy. They may receive the vaccine if the benefit of vaccinating a pregnant woman outweighs the potential vaccine risks. So now, let's talk about people who are not recommended to take this vaccine. People who are not recommended to take this vaccine are people with a history of severe allergic reaction to any component of the vaccine should not take it. This is because it will make he or she suffers. Besides that, vaccine also is not recommended for persons younger than 18 years of age pending the results of further studies. The European Medicines Agency, EMA, has thoroughly assessed the data on the quality, safety, efficiency of the vaccine and has recommended creating a conditional marketing authorization for people aged 18 and above. Clearly that vaccines are important to us, and to prevent the danger of COVID-19, we have to take this vaccine as a way to avoid it. I hope that all people who are responsible to our world, please take the vaccine and do not be selfish.
Up to 4 June in Malaysia, around 1.18 million have fully vaccinated, which is only 3.7% population fully vaccinated. The government, as a reward goal, is marshalling up all the resources to ramp up vaccination up to 200,000 daily doses. Such a welcome news, which means that the country, if everything is on the track, could hit 80% herd immunity before the end of this year, thus minimizing the severity of COVID-19 infections among more than its 32 million population. Tan Sri Muhyiddin Yassin urged for the special committee on COVID-19 vaccine supply to study making vaccination mandatory if the number of registration does not reach the herd immunity target is undoubtedly timely and the most appreciated. Hopefully, the high daily tally of facility and infection will open their eyes to the reality of what this pandemic could really cost to their life and their loved one. Anti-vaccine movement is not something new nowadays. Both the Health Ministry as well as the World Health Organization (WHO) have stated that anti-vaccine poses a threat to the whole world. This group would make baseless, supremacist assumptions and accusations which are conveyed not only among themselves but also to the community and people around them. Indirectly, they encourage a wider group of people to reject vaccine, putting them on a dangerous territory. If we allow this group to continue separating their influence to the society, will we just put ourselves more up to dangers and perils? This can be proved to be detrimental not only to our life and livelihood but also to the country, which will be in shambles if nothing is done about this group. Just like those as of Vivalera, similar sooner and stiffer and action should be taken against this group. Let us all fight this virus and be crusaders for the vaccine. I think that's all from our group. Thank you.
Nama saya Nurin binti Muhammad ZAMRI. Saya pelajar tahun 3 di Universiti Malaysia Kelantan UMK, kampus Jeli.
Saya Muhammad Akmal bin Roslan. Saya belajar di Universiti Teknologi Petronas di Perak.
Nama saya AMIRATUL binti Rahman. Saya pelajar tahun 1 Universiti Malaysia.
Pertamanya vaksin COVID-19 ni adalah satu imunisasi yang untuk membentuk dan meningkatkan imun tubuh badan kita.
Ia salah satu cara yang kerajaan bagi dekat kita untuk membendung masalah penularan COVID-19, iaitu dengan memberi vaksinasi kepada rakyat.
Vaksin COVID-19 ni ada dalam 4 atau 5 jenis. Yang pertama adalah vaksin COVID jenis Pfizer, dan yang kedua adalah vaksin COVID jenis Astrazeneca.
Pfizer ialah mRNA punya teknologi, di mana keberkesanannya sebanyak 95%. Astrazeneca dia berasal daripada Oxford, iaitu keberkesanannya sebanyak 75%.
Saya tak begitu mana vaksin sebab sekarang ni dekat Malaysia pun kita ramai lagi yang mendapat vaksin. So bagi saya, vaksin yang kita boleh, vaksin yang kita sempat daftar tu lah vaksin yang paling sesuai untuk kita. Saya sangat setuju kalau vaksin ni diambil untuk kesihatan masyarakat. Memang ada orang cakap dah ambil vaksin pun still kena COVID-19, tapi vaksin tu dia mengurangkan efeknya kalau kita dah kena COVID-19. Macam masa kita baby pun kita ambil vaksin untuk kurangkan kesan bila kita sakit kan. So sama juga macam vaksin COVID-19.
Untuk kita menghentikan penularan wabak COVID-19, maka semua rakyat digalakkan untuk mengambil vaksin. Jika kita hendak menamatkan norma baru dan hidup seperti biasa, seperti sebelum ni, saya saya sarankan bahawa semua orang patut mengambil vaksinasi.